The vertebrae share many of the same structures, and the structures that they do not share we can use to help identify them and tell them apart. The three types of vertebrae are cervical, thoracic, and lumbar. The quickest way to tell them apart is cervical vertebrae have 2 extra foramen. Thoracic vertebrae have rib articulating faucets on the body and on the transverse process. Lumbar vertebrae have none of these. Let's look a little bit closer to see the other structures. We use a lumbar vertebrae, as it'll show all structures for us, and then we'll use the other vertebrae to highlight the differences. There is a body. That is the large bone portion. We have the vertebral foramen. The processes that are going lateral from the neural arch are the transverse processes. The process that is going posterior from the neural arch is the spinous process. The body and the neural arch make up the vertebral foramen where the spinal cord would pass through. The differences in the wall of that neural arch are the lamina and the pedicle. Between the processes, the wall is a little bit different, so it is the lamina. Between the body and the processes, the wall is called the pedicle. So on the thoracic vertebrae, we have all the same structures, but we added the costal faucets. And those structures indicate to us that they are thoracic vertebrae. All the vertebrae will interlock with a series of superior articulating processes with smooth faucets on them, superior articulating faucets, connecting to the inferior articulating faucets on the inferior articular process of the vertebrae above it. And then the next vertebrae, and so forth, up and down the vertebral column until you get to the skull and the sacrum. The cervical vertebrae have all the same structures, except in the transverse process, there is an additional opening. This opening is the transverse foramen.